One such drug that has garnered significant attention is Sucralfate, a medication primarily used for the treatment of gastrointestinal conditions. In this comprehensive video, we will delve into the intricacies of Sucralfate, exploring its common uses, benefits, potential adverse effects, dosage recommendations, and potential dangers associated with its usage. Sucralfate, a sucrose sulfate aluminum complex, is a unique medication that exerts its therapeutic effects by forming a protective barrier over ulcerated areas in the gastrointestinal tract. This barrier not only promotes healing but also shields the affected areas from further irritation caused by gastric acids and enzymes. By understanding the diverse applications of Sucralfate, we can better appreciate its role in managing various medical conditions. Common medical conditions treated with Sucralfate. Sucralfate finds widespread application in the treatment of several gastrointestinal disorders, including peptic ulcer disease, PUD. One of the primary indications for Sucralfate is the management of peptic ulcers, which can occur in the stomach, gastric ulcers, or the duodenum, duodenal ulcers. Sucralfate's ability to form a protective barrier over the ulcerated areas facilitates the healing process and alleviates associated symptoms. Gastroesophageal reflux disease, GERD. Patients suffering from GERD, a condition characterized by the backflow of stomach contents into the esophagus, may benefit from Sucralfate's protective properties. By forming a barrier, Sucralfate can help reduce the irritation caused by stomach acid on the esophageal lining. Stress-related mucosal damage. In situations of physiological stress, such as intensive care unit, ICU, admissions or major surgeries, the gastrointestinal mucosa can become vulnerable to damage. Sucralfate is often prescribed as a preventive measure to protect the mucosal lining and reduce the risk of complications. Radiation-induced mucosal injury. Patients undergoing radiation therapy for certain cancers, particularly those affecting the pelvic region or abdomen, may experience mucosal damage. Sucralfate can help alleviate the associated discomfort and promote healing of the affected areas. Benefits of using Sucralfate. The use of Sucralfate offers several potential benefits, including ulcer healing. Sucralfate's ability to form a protective barrier over ulcerated areas in the gastrointestinal tract promotes the healing process and reduces the risk of further irritation or bleeding. Symptom relief. By shielding the affected areas from gastric acids and enzymes, Sucralfate can alleviate symptoms associated with gastrointestinal conditions, such as abdominal pain, nausea, and discomfort. Mucosal protection. Sucralfate's protective properties extend beyond ulcers, as it can also safeguard the gastrointestinal mucosa from damage caused by various factors, including stress, radiation, and certain medications. Reduced need for antacids. In some cases, Sucralfate may reduce the need for antacid medications, which can have potential side effects or interactions with other medications. Potential adverse effects of Sucralfate. While Sucralfate is generally well tolerated, it is essential to be aware of potential adverse effects that may occur during its use. Some of the commonly reported side effects include constipation. Sucralfate can cause constipation in some patients, particularly with prolonged use or high dosages. Nausea and vomiting. Although rare, some individuals may experience nausea or vomiting while taking Sucralfate. Diarrhea. In certain cases, Sucralfate may lead to diarrhea, which can be a concern, especially in patients with pre-existing gastrointestinal conditions. Allergic reactions. While uncommon, allergic reactions to Sucralfate can occur, manifesting as rash, itching, or difficulty breathing. It is crucial to report any adverse effects to your healthcare provider promptly for appropriate management and potential dosage adjustments or alternative treatment options. Recommended dosage of Sucralfate. The recommended dosage of Sucralfate varies depending on the specific medical condition being treated and the patient's individual circumstances. Generally, the following dosage guidelines are observed. Peptic ulcer disease, PUD. The typical dosage for the treatment of peptic ulcers is 1 gram, 1000 milligrams, 4 times daily, taken on an empty stomach or at least 1 hour before meals. Gastroesophageal reflux disease, GERD. For the management of GERD, the recommended dosage is typically 1 gram, 1000 milligrams, twice daily, taken 1 hour before meals. Stress-related mucosal damage. In cases of stress-related mucosal damage, the dosage may range from 1 gram, 1,000 milligrams, twice daily to 1 gram, 1,000 milligrams, 4 times daily, depending on the severity of the condition and the patient's risk factors. Radiation-induced mucosal injury. For the prevention and treatment of radiation-induced mucosal injury, the recommended dosage is usually 1 gram, 1,000 milligrams, 4 times daily. It is essential to follow your healthcare provider's instructions carefully and not exceed the recommended dosage without medical supervision. Adjustments may be necessary based on individual factors, such as age, kidney function, and concomitant medications. Precautions and dangers associated with sucralfate usage. While sucralfate is generally considered safe when used as directed, there are certain precautions and potential dangers to be aware of. Interactions with other medications. Sucralfate can interact with various medications, potentially affecting their absorption or efficacy. It is crucial to inform your healthcare provider about all the medications you are taking, including over-the-counter drugs, vitamins, and supplements, to avoid potential interactions. Kidney function monitoring. Sucralfate is primarily eliminated through the kidneys, and its use may require monitoring of kidney function, especially in patients with pre-existing kidney disease or those taking other medications that can affect kidney function. Aluminum toxicity. Sucralfate contains aluminum, and prolonged or excessive use may lead to aluminum accumulation in the body, potentially causing aluminum toxicity. This risk is higher in patients with kidney dysfunction or those taking other aluminum-containing medications. Constipation and bowel obstruction. Due to its potential constipating effects, sucralfate should be used with caution in patients with a history of constipation or bowel obstruction. Pregnancy and breastfeeding. The safety of sucralfate during pregnancy and breastfeeding has not been fully established, and its use should be carefully evaluated by a healthcare provider, weighing the potential benefits against the risks. It is crucial to follow your healthcare provider's instructions carefully and report any concerning symptoms or adverse effects promptly. Alternative treatment options to sucralfate. While sucralfate is an effective treatment option for various gastrointestinal conditions, there may be situations where alternative treatments are preferred or necessary. Some alternative options include proton pump inhibitors, PPIs, such as omeprazole, esomeprazole, and pantoprazole, are commonly used to treat conditions like peptic ulcers and GERD by reducing stomach acid production. Histamine 2 receptor antagonists, H2-ROS, like ranitidine and famotidine, work by blocking the action of histamine, which stimulates stomach acid production, making them useful in the management of acid-related conditions. Antacids. Over-the-counter antacids, such as calcium carbonate or aluminum hydroxide, can provide symptomatic relief by neutralizing stomach acid, but they do not promote ulcer healing or address the underlying cause. Lifestyle and dietary modifications. In some cases, lifestyle changes, such as avoiding trigger foods, managing stress, and quitting smoking, can be beneficial in managing gastrointestinal conditions, either alone or in combination with medications. The choice of alternative treatment options will depend on various factors, including the specific condition being treated, the patient's medical history, and potential side effects or interactions with other medications. Frequently asked questions about sucralfate. How does sucralfate work? Sucralfate forms a protective barrier over ulcerated areas in the gastrointestinal tract, shielding them from further irritation caused by gastric acids and enzymes, promoting healing. Can sucralfate be taken with other medications? Sucralfate can interact with various medications, potentially affecting their absorption or efficacy. It is crucial to inform your healthcare provider about all the medications you are taking to avoid potential interactions. How long does it take for sucralfate to work? The time it takes for sucralfate to provide relief can vary depending on the condition being treated and the individual's response. Some patients may experience improvement within a few days, while others may require longer treatment durations. Are there any dietary restrictions while taking sucralfate? It is generally recommended to take sucralfate on an empty stomach or at least 1 hour before meals to ensure optimal absorption and effectiveness. Can sucralfate be used long-term? While sucralfate can be used for extended periods, prolonged or excessive use may increase the risk of adverse effects, such as constipation or aluminum accumulation. It is essential to follow your healthcare provider's instructions and undergo regular monitoring. Conclusion: Sucralfate is a valuable medication in the treatment of various gastrointestinal conditions, particularly peptic ulcers, GERD, and radiation-induced mucosal injury. By forming a protective barrier over ulcerated areas, sucralfate promotes healing and alleviates associated symptoms. However, it is crucial to be aware of potential adverse effects, dosage recommendations, and precautions to ensure safe and effective use. If you or a loved one are considering sucralfate as a treatment option, it is essential to consult with a healthcare professional. They can provide personalized guidance, address any concerns, and recommend the most appropriate course of action based on your individual circumstances. Remember, while sucralfate can be an effective treatment option, it is always advisable to explore alternative treatment options and lifestyle modifications in conjunction with medical advice. By staying informed and working closely with your healthcare provider, you can make informed decisions that prioritize your overall well-being. If you have any further questions or concerns about sucralfate or its use, don't hesitate to consult with our healthcare professionals. We are here to provide you with personalized guidance and support to ensure your optimal health and well-being.